Morning, everyone. Take off my glasses because of reflection, but good morning. Um, it's Tuesday, and coronavirus cases continue to increase. Let's see. Hope everyone's doing okay on this Tuesday. Cloudy and I don't think it's actually raining here. Streets are wet, so I'm here in New Jersey. Give everybody a minute to see if anybody's who's going to be coming on. Well, let's see. The number of coronavirus cases are for today. Looking at the Worldometer, coronavirus cases, U.S. now 164,000 with 3,100 deaths and 5,500 people have recovered. Most of our cases are still active. So, New York has 67,000 cases with 1,300 deaths, and but 61,000 active cases. So, New Jersey, 16,000 cases, 198 deaths, and yeah, you know, almost all the cases are still active except for about 200. So, yep, cases are still going up, obviously, across the country. Louisiana now has 4,000. California, 7,000. So, good morning, Michelle. How are you? Just was viewing the coronavirus cases and obviously seeing that they're still going up. And, you know, figure out I'll going to go one more time over the information that got from Dr. David Price's video. I don't know if you've watched that yet. Good morning, Nancy. Yes, this is becoming a thing in the morning. Committed to making this a routine. So let's, you know, tomorrow it'll be a little bit different format. I'm going to do a post today that talks about, you know, gives information about when you should see a integrative medicine doctor. You know, Nancy, you made that decision. So hopefully we can share this with family and friends so they can see the varied reasons that we do this. I'll talk about it again later. But I also want to collect stories from people about reasons why they did seek out integrative medicine. I don't know. I'll probably also, you know, weave in why I decided to become an integrative medicine doctor throughout the series. So hopefully we can get some people engaged in that. All right, so I'm gonna, without further ado, I'm gonna talk some more about the Dr. David Price's video. I know you watched it, Nancy. You'd watched it by yesterday. So if anybody has questions or anything, let me know as I go along. You know, again, Dr. David Price critical care doctor at Weill Cornell Medical Center in New York City posted a video. It's posted on our website, and he feels that we can, number one, prevent ourselves from getting coronavirus, and that we can allay fear and anxiety. And he points out the common mistakes that's allowing it to spread. So he says that we can prevent people from getting it by becoming what he calls a hand Nazi. That if you are compulsive about cleaning your hands anytime you touch any surface, that somebody else touches, or where a drop, you will reduce the spread of virus because it's spread by droplets. So if you don't put those droplets onto your hand, or if you put them on your hand, you wash them off. And he said that it responds very well to soap and water or to hand sanitizer. It destroys the virus. Second thing he said is work on the connection between the hand, face, mouth, nose, and eye. If you touch your hand to your face, to those areas, that you're going to transfer droplets from whatever surface from somebody else's hand, those areas, and then will cause transmission. He recommends wearing a mask, and actually, as we were listening to MSNBC, they were also, a couple of doctors that I heard on there were also recommending masks. Number one, when you wear a mask, you prevent your droplets from going as far into the environment. And number two, it reminds you not, creates a physical barrier around your mouth and nose. So you are less likely to be able to transmit virus by touching your hand to those areas. Make sure when you go to take your mask off that you sanitize your hands. And fourth way is to maintain social distancing, maintain distance of 3 to 6 feet in between people. And I introduced the terminology from my son Justin, that we should be distantly socializing. We should take this opportunity. Good morning, Jenna. We should take this opportunity to connect with people via internet, phone, talk to people. Hey, even send cards and letters to people if you have some that you can get out. All right, so let me just go through some of the points that Dr. David Price made, some of the questions that he had. So, he talked about whether you can get, delivery of packages, delivery of food. He said he feels very comfortable getting delivery, unlikely transmission via that route, but to be cautious and wash your hands afterwards. Again, once you wash your hands, you've destroyed the virus and you can't transmit it that way. He advises people to shrink their social circle. I think most people are doing that. Don't go into situations where you have contact with a lot of people. And for goodness sake, I don't think anybody that I see here would do it, but tell your friends and family, and don't go to a coronavirus party. That's really a bad idea. He sees a lot of transmission in families, so families have to take extra precautions, especially if anybody starts coming down with symptoms. They should self-isolate, and that probably put a mask on and that kind of thing if they need to interact. But self-isolating, having their own room and their own bathroom is the best situation. But if not, using masks and practicing scrupulous hand hygiene is the next best thing. Again, if you have a cold, if you're starting to come down with cold symptoms, you're not sure it's going to be coronavirus, isolate for 2 days. If you don't feel worse during those 2 days, you most likely do not have coronavirus, and can start interacting with people again. again, maintaining that social distancing anyway. The problem he sees that during early illness, people are not isolating. So, refer to what I said above. Um, that spreads the virus. Part of the reason for the social distancing, socially isolating, contracting our social groups is that some people with early illness, they can shed the virus for a day or two before they actually become symptomatic. So if you're maintaining social distancing and practicing good hand hygiene, we can break that chain of transmission. And once they have full-blown disease, um, transmission happens if they're interacting with others too much, others who are not taking the proper precautions. He feels if you take the proper precautions, if you wear a mask so you're not touching your face and are washing your hands scrupulously, that you can actually help care for coronavirus patients. But you have to be really compulsive about it. Um, Especially if you have a vulnerable population, anybody over the age of 80 especially. Their mortality rises steeply at 80, or somebody who's been chemotherapy or immunosuppressed for any reason, people with immunosuppressive disorders, other cancers, HIV, that kind of thing. This group does not include people who have autoimmune disease for the most part. Usually their immune systems are still able to handle viruses and that kind of thing. So, but people who are actually immunosuppressed, low white blood cell counts, low neutrophil counts, uh, um, they might have a lot of trouble. So they should be treated extra carefully. Who should go to the hospital? He feels you should only go to the hospital if you feel short of breath, because otherwise there's nothing that can be done at the hospital to really help your situation. If you are short of breath and he feels that about 10% of the population that gets coronavirus will become short of breath, then you should go to the hospital. Of those 10% that go to the hospital, about 2 to 3% will need the ICU and possibly ventilators. And in his experience, the vast majority who are going on ventilators are coming off. Let me see Nancy's question. Shopping options become more challenging, and taking Dr. Price's advice, I still have mixed feelings about what to do. So does it make a difference, or is it any better to have my young adult daughter do some of the shopping? Keep in mind she's living with us. Well, um, you know, if your young adult daughter is probably likely to suffer less severe disease, um, so if she was exposed there, it would be, for her, it would be, you know, um, probably less of an issue than it would be for you. But you have to think about, um, if she gets sick, you know, are you going to be able to keep yourself from getting sick? Do you feel like you can do the things you need to do? Um, and who is, I guess I would say if she is taking the precautions that I mentioned, wearing a mask and keeping her hands clean and sanitized, um, and not touching her face. Um, I think that's totally a fine plan. Um, so, you know, I think you just have to decide how you want to do it. But, I think it would be fine for, your daughter to do that if she's willing to do that and is willing to take the precautions. If you don't think she's going to take precautions, then I would recommend that you do it yourself because um, she's could possibly get infected. Um, but if she's going out anyway, sure, have her do the shopping. So, all right. Hope that answered the question, Nancy. I hope that helps you make your decision better. Next question that Dr. Price addressed, should I get tested? If you have a flu-like illness at this time, you can probably presume it's COVID-19. If tests are scarce in your area and you are not short of breath, then there is probably no reason to get tested. You can leave the testing to people who are feeling short of breath. Um, if they're testing a lot of people in your area and there's no scarcity of testing, then if they're starting to do contact tracing or anything in your area, then by all means get tested. But if there's scarcity of testing, which there still is in New Jersey, I would recommend that unless you're short of breath, that you don't get tested. In terms of transmission, babies, it doesn't appear to be transferred from pregnant mom to fetus, so there's not a vertical transmission that way. They feel that if babies are getting infected, it's after birth. And, there's been very, very little symptomatic disease or critical illness in babies. I did hear about one baby that died in Illinois, but that's only one baby, and we don't know the circumstances of that compared to the other number of people dying. It's that seems to be an extremely rare event. According to Dr. Price, they're seeing almost no severe disease in anyone younger than age 14. So, at least our children seem to be protected from this. And mentioned that it's transferred by droplets. So if you can get droplets on your hand and wash them, you're safe. If you're keeping your hands away from your face, you're safe. And so, we talked about masks, but bandanas, scarves, that kind of thing, anything that reminds you not to touch your face would work just about as well as the mask does. And with the shortage of masks in some hospitals, they had actually been recommending that people used bandanas or scarves. I didn't quite understand why, but now I understand that it's because of they just wanted people to keep their hands away from their face. Somebody asked if they could go to Starbucks. He said, after you get the cup, sanitize your hands, follow the rules, just follow the rules with social distancing, that kind of thing. Somebody asked, do you have to wash your clothes after you go to the grocery store? And he didn't feel like you needed to. Healthcare workers who are getting a large exposure to coronavirus. He feels should wash their clothes. Marcia has a question. Good morning, Marcia. Is it because kids aren't getting tested, she's asking, that they're not seeing disease? Well, again, Dr. Price's comment was there's almost no severe disease, so kids aren't ending up in the hospital. They may indeed be getting COVID-19, and actually, there were some children peripherally connected to our practice, not anybody been in the office recently or anything, but who had COVID-19, but all symptomatic illness in children seems to be resolving without any severe sequelae. We're not hearing about kids going to the hospital in critical states, being short of breath, needing to be on ventilators or anything. That seems to be exclusively in adult populations, and it seems, more in the 30s. Seems to be a gradient of illness. Maybe in your 30s, there are a few percentage that are getting severely ill and needing ventilators, but almost all of them are coming off the ventilators unless they have underlying conditions. Whereas if you're 80 and get severely ill, a large portion of that population is having mortality. So there appears to be a gradient that starts in childhood and goes into the extreme elderly. That the younger you are, the better you do. Even if you get as I said, if you get critically ill in your 30s, you're likely to do better than somebody who gets critically ill in their 80s. So the kids aren't getting tested because number one, because there's a scarcity of testing, and number two, because they're not getting that sick. They're having more like flu-like illness. So um, this one family that I'm referencing, one of the children got sick in January, um, and they weren't sure what that was. Could have been the flu, but then a second one got sick, and he got tested, and he had COVID-19. And then the mom was coming down with symptoms. She got tested and also had COVID-19, and then a third child got they're all doing fine and recovering, but yeah, the kids uh, the kids are getting it. They're just not getting the severe critical illness. Um, so, hope that answered your question, Marcia. So Nancy put a comment there. She thinks it's a myth, but there are some do-it-yourself tests out there, clinical tests that you can do about holding your breath. Holding your breath for 10 seconds without coughing means you're infection free. I hadn't heard about that, Nancy. Not sure how reliable that is. Sue's telling me she's heard that on the internet also. Um, I don't know. I don't know that there's been any clinical testing. Um, you know, I guess maybe it's, you know, if you're um, if your respiratory tract is irritated, then um, it is more likely that when you're holding your breath, you'll start coughing. But I don't know. I don't know where the 10-second rule came from. I'll have to see if I could do a little digging on that one. Thank you for that one, Nancy. Um, let's see. How long does it take to get it? What's the incubation period? The higher amount of exposure, the shorter the incubation period. With just casual contact, say you're at a party and get exposed to one person, could be up to 14 days. But if you're a hospital healthcare worker, could be much shorter, 3 to 5 days. So, but that's why the 14-day rule. If you've been exposed to somebody. If you don't have it within 14 days, it's extremely unlikely that you're going to get it. Um, he mentioned that he is seeing a lot of 35-year-olds who are getting and up, who are getting more severely ill. As I mentioned above, about 35-year-olds. Below that, he seems to feel that it's a much less severe illness. Um, Ibuprofen, he feels that there's some literature out there that you do worse if you're taking the non-steroidals, the ibuprofen, the Aleve, aspirin. Um, they're not using it in the hospital anymore. They're just using Tylenol. I'm not sure how strong that evidence is, but that's what he references, and that's what they're doing in the hospital. Um, let's see. He feels that there will be probably a second and third wave, but that the initial step is to flatten the curve, and those second waves and third waves are much smaller spikes because as it moves through the population again, there are a number of people who are going to be immune. And yes, they do feel that people are developing immunity to this, so that when it comes back through, that there'll be much less um, spread and severe disease. So we should learn the four rules about the hands and the hand to face connection. Washing the hands, hand to face connection, um, and washing the wearing a mask and keeping our social distancing, because we're going to have to do this for a number of months. I think we're going to get back to some semblance of normal life at some point during that, and that's when there's going to be that second wave and third wave. But again, it's not going to be as bad. At least, that's the way it's been they felt in previous epidemics, pandemics. Um, mention the immunity. Um, Somebody asked about pregnant women. He has seen 0 pregnant women in his ICU. It does not appear to be more severe if you're in pregnant women. Um, and most of the people that he's seen in the ICU are actually male. So there might be, we're not sure why that is yet, whether it's just his population or women are somehow protected from this. Um, so, and so that's about it. Let's see. Let me see if there's any other questions. Morning, Holly. Nancy Javelin, can a person abuse Purell by using too much? Nancy, the side effect of that is going to be too much, um, is going to be dry skin, maybe dermatitis. It's not that the virus is going to get immune to it or anything like that. Um, so, you know, I use Purell when you need to. I mean, I think, it can be drying. Um, keep your hands sanitized in between. I'm sorry, hand moisturized in between to try to prevent that drying. Um, in the situations where you can actually wash your hands. I know that's drying also, but there are some soaps that are moisturizing. If you wash your hands for 20 seconds, some people suggest singing happy birthday to yourself while you're doing that to get the right time frame. Um, Give you a little break from the Purell. That's probably something good too. Okay. Um, all right. I don't see any other questions coming in. Um, so again, Dr. David Price's video, great information, allayed my some of my anxieties and stress about the disease, and you can get that on Princeton Integrative Health videos, Facebook page, or Google Dr. David Price. He's at Weill, Weill Cornell Medical Center. He's a critical care doctor there. Um, and check out Jenna's immune support group for great information. And starting tomorrow morning, I mean, I'll still be talking about coronavirus some, but I'm going to shift gears somewhat and start a new series uh, titled "You Need a Functional Medicine Doctor When." I want to talk about the reasons people need functional medicine, integrative medicine doctors, um, and I want to hear your stories. I want to hear stories from people as to why they sought out integrative functional care. um, I think that'll be interesting and can help educate the rest of the population. I mean, part of my mission is to educate, a big part of my mission is to educate the population about this different lens, this different paradigm of medicine. And so I could use all the help I can because that is a gargantuan task. So I need people to help me raise awareness so we can get the whole population healthier, and not just you folks who are on the leading edge and seeking this out. So um, you know maybe someday we'll even get insurance companies to pay for it. Wouldn't that be wonderful? So okay. No other questions. I'm going to sign off for today, and I will see you tomorrow morning. And I'll post today about you need an integrative doctor when, and it'll be about the some facts about the microbiome. So okay, I will hopefully see you tomorrow morning. Okay, take care.